My son Max was one of a kind. He was brilliant, wise, witty, and had the biggest heart. But Max also struggled with his mental health. Max died by suicide in 2013. In his honor and memory, I have devoted myself to the pursuit of making mental health care more accessible to those who need it the most. So in 2013, we founded the Max Gray Fund for the Treatment of Mood Disorders. The fund supports 1 to 3 year fellowships in either the Max Gray Child and Adolescent Mood Disorder Clinic, or CHAMP, or the Adult Mood Disorders Clinic. The Max Gray Fellowship attracts some of the most talented early career psychiatrists and psychologists. They come to UCLA from preeminent medical schools across the nation. CHAMP and the Adult Mood Disorders Program are directed by doctors David Miklowitz and Michael Gitlin, two of the most outstanding leaders in the field.
When Lori first suggested that the fellowship could sponsor one fellow a year, that markedly increased the number of patients that we could see.
I think it's allowed us to train more specialists in childhood mood disorders. So these folks will eventually go out and have their own practice or work at a university hospital.
The average wait time has been cut down for a first appointment to 2 weeks, which is essentially unheard of in the mental health care community.
I've been able to hone my clinical skills in the Max Gray Fellowship in so many ways. First and foremost, in the evaluation and diagnosis of kids with mood disorders or suspected mood disorders. Pediatric bipolar disorder is particularly tricky to diagnose, and so I've been able to train under individuals with a lot of experience. I feel a lot more confident in my ability to diagnose.
Oftentimes in other clinics you feel rushed in terms of your assessment, and so this allows me to be very thorough, allows me more time to reach out to previous providers, and it takes away some of the administrative burden. Just with that extra time, I'm able to be more thoughtful than I think I am with oftentimes in other cases.
The lens that I use with my patients in individual psychotherapy is often psychodynamically oriented. I'm also very interested in family-focused therapy and how that can be adapted for immigrant populations, particularly the South Asian immigrant population. Being in the presence of people who have contributed so much to the field and who will be contributing so much to the field is always inspiring.
So we learn to ask questions in a very systematic way, and then we learn to educate parents on how to support their child that may have bipolar disorder or mood disorder. We have family therapy in this clinic, and so we learn a lot of useful skills.
Please join me in supporting the Max Gray Fund, because no one should suffer alone. We can certainly do better in our quest to make high-quality mental health care available for those who need it the most. Thank you.